Since this man is relatively young, it is likely that his PAD is caused from diabetes.
Nurse Nancy, what arteries again are usually affected in PAD of the extremities?
Dr. Doom, sometimes your lack of knowledge even amazes me. If you remember, it is the femoral popliteal area that is most commonly affected in non-diabetics. However, the patient with diabetes tends to develop disease in the arteries below the knee. Specifically, the anterior tibial, posterior tibial and peroneal arteries.
That's right, I remember now. It's all coming back to me. So what are the complications seen with PAD?
Prolonged ischemia leads to atrophy of the skin and underlying muscles. Because of the decreased arterial blood flow to the lower extremities, even minor trauma to the feet may result in delayed healing, wound infection, and tissue necrosis.
And ulcers. Right.
Correct. Arterial ulcers most commonly occur over bony prominences on the toes, feet, and lower legs.
Well, before we knocked out this poor chap with that strong cocktail of drugs, he did mention he wishes to stay ulcer-free. How can he go about doing that?
The best way to do that is with proper treatment and good nursing care. Due to the high risk for MI, ischemic stroke, and cardiovascular-related death in patients with PAD, the first treatment goal is to aggressively modify cardiovascular risk factors in all patients with PAD, regardless of the severity of symptoms.
So I get to cut him open?
No, not exactly. Treatment is first aimed at smoking cessation, aggressive hyperlipidemia treatment, hypertension control, diabetes control, and antiplatelet therapy.
Well, what is the nursing care involved for those?
To help him quit smoking, you may refer the patient to a support group or a program. For control of hyperlipidemia, you should emphasize the importance of maintaining a therapeutic regimen. For hypertension and diabetes, it should be reiterated to the patient how important proper control is for delaying the progression of PAD. Antiplatelet therapy,
like aspirin,
is used to prevent platelet aggregation and decrease atherosclerosis.